Welcome to this episode of Health Vision. Today, we are at the Information Technology Optimization in Healthcare Conference in San Juan, Puerto Rico. And we're going to soon be hearing from our experts on what they provide as far as information technology in healthcare and how their solutions are going to be changing in the rapidly changing healthcare field.
Vital Images is an organization that develops advanced clinical applications, cardiology, radiology, oncology. We've been in the business for about 20 years. Our initial development was a product that was designed to speed to clinical decision, developed around ease of use, accessibility, availability. We have since built that product into a server-based application in which we distribute that product across the enterprise, bringing those tools closer to the physician's hands. That's a very interesting question, and if you look at the types of discussions that are currently had today, we have the bits and bytes discussions, the delivery discussions. What revolves around those discussions is taking imaging and taking visualization and taking communication in the form of visualization and delivering it to the healthcare provider, the end user, if you will, who's meeting with that patient on a daily basis. For us, as an organization, our challenge when we go to speak to an IT provider is, first of all, they want to make sure they control their cost of ownership. They want to be using industry standard products, hardware, software, etc. And they want to be able to manage these large amounts of data effectively and intelligently deliver that. So if you look at our platform, that's the kind of platform we have designed. It's a high-end data management platform. So that's how we're addressing our portion, or what we see as our responsibility for the piece of the puzzle within IT management within healthcare today. Interesting question. Historically, advanced visualization, if you think of interpretive visualization to aid in interpretation of data sets, CT, MR, PET, high-end imaging modalities. The visualization tools that have been developed, the clinical visualization tools that have been developed, have historically been with the imaging owner, the stakeholder for that imaging modality. So you could think of radiology or cardiology or oncology. And I think that if you talk to patients today, what they want and what they need is improved communication. They want to know what type of care they're getting and what they're being treated for outside of a textual report. That EMR will be a standardization for access to patient information. A single medium, if you will, within a healthcare enterprise to access both the verticals and the horizontal layers of patient information. The delivery of the imaging and the applications through that medium to the end user, I just think is something that's I believe a lot of other people feel that it's something that's just naturally going to happen.